So, welcome to the information sessions that we've been hosting for the last couple of weeks. My name is Elise Mendel, and I am the Director of Career Services at Baruch College's Weissman School of Arts and Sciences graduate programs. And I've been doing a series with organizations who actually were interested in attending the IO Psych Career Fair, and we're very happy that so many have agreed to come on to do these sessions. And I'm really excited about welcoming Northwell Health, who has great human resources practices and employee engagement, as well as in the thick of everything in terms of what's happening in this world around the pandemic. So it's going to be wonderful to hear about what they're doing within the human resources field and employee engagement. And without further ado, I wanted to turn it over to Michael, Irene, and Donna from Northwell. And there you go. Thanks. And one last thing I almost forgot is that after the presentation, we'll be opening up for questions. So feel free to put your questions in the chat box and I'll be reading them out. All right. Go to it.
Hi, everybody. We'll take a second maybe and just introduce ourselves very quickly. Thank you again for having us. We're really excited. I'm Mike Kern. I am the Director of Human Resources for Long Island Jewish Medical Center. Irene or Donna?
Okay. And hi, everyone. I am Donna Chiche, the Deputy Regional HR Officer for East and Central Region and the Head of HR for here at North Shore University Hospital.
Hi, good evening, everyone. My name is Irene Ferranda, and I am the HR leader at Southside Hospital out in Suffolk County, Bay Shore, New York. Okay, so I'm gonna get us started if that's okay. We felt like we wanted to give you a little bit of an organizational overview before we got into a lot of the IO specific careers and projects that we're working on. So we're 72,000 people strong at Northwell, and really what we believe is that we look at healthcare differently. In our name, you see the word well, so we really focus on from birth all the way throughout your life, focusing on your wellness, prevention, as well as overall care. So some of the highlights of things that we're recognized for are being one of Fortune 100 best places to work for 2020, as well as a Fortune 100 place for diversity, as well as one of our nation's recognized employers for military veterans. We have one of the largest residency programs in the country. So not only do we focus on developing doctors for our own health system, but for the state as well as the world. So when you think about it, as I mentioned, we're more than a health system. We have 23 hospitals, over 800 outpatient facilities, and I'm going to show you a map on the next slide. But really what we're most proud of is our investment in the community. You know, we've put in $1.4 billion into community benefits, everything from outreach to our local communities and education, as well as providing cancer screenings, blood pressure, heart and health. And most recently, you've probably seen on the news the significant investment in serology testing in the community related to COVID. So making sure that we not only take care of our team members, our patients, but really making an investment in improving our community and the communities we serve. So here's our snapshot. You know, if you look at the map, you can see that we're not just a Long Island-based company. We're the largest private employer in New York State. So some of our facilities that you may know from New York City are Lenox Hill or our facility in Greenwich Village. So Upper Westchester, we also have hospitals in Staten Island. So we're beyond Long Island in terms of our footprint within the North and Eastern region. We also have affiliations and partnerships in Boca Raton, Florida, as well as in Stockholm and Australia with Epworth Health. And what we're most proud of is our Feinstein Institute. So we have our own research institute where we have 5,000 team members focused right now on 2,500 different clinical trials, as well as, you know, publishing a lot of the research to help education within our communities. Our Feinstein Institute has 5 different institutes, and they're focused on research in behavioral sciences, bioelectric, electronic medicine, cancer research, health innovation, as well as molecular medicine. So you can see we're not only building future clinicians through education and deployment, but we're also focused on making improvements to healthcare and the larger scheme overall. So I'm just going to show you quickly, just 3 quick snapshots of the hospitals that the 3 of us work for. So Michael is our HR leader at Long Island Jewish Medical Center, which is on the border of Queens and Nassau County, Long Island. And you can see they have over 5,000 employees. They're magnet recognized for their expertise in nursing, which is a national award. They have over 583 beds, and they last year gave birth to over 9,000 babies. Donna is our HR leader, as she mentioned, at North Shore University Hospital, and that's really our mothership hospital, as we call it. And they're well established, is our largest hospital within the health system, and they're known for trauma, their heart programs, as well as their neurosciences program. And, you know, they have the Sandra Atlas Bass Heart Hospital, which is world-renowned, as well as they conducted the first heart transplant successfully on Long Island. So we're very proud of that. Mm-hmm. And then finally, my Southside Hospital, we are a growing tertiary hospital, and tertiary means can handle anything. So we're on the trajectory to become similar to Mike's hospital in our growth and in our programs. We're known for orthopedics, we're known for cardiology, as well as we just created our own neuroscience program here, and we are a level 2 trauma center. So you can see when you think about a larger organization, different subcultures within the organization based on where they are within their growth strategy. So that's an overview of our organization, as well as where we come from HR professionals. So I'll go ahead and turn it over to one of my colleagues to continue.
Thanks, Irene. So we're going to talk to you about sort of 2 large buckets in our organization where you can leverage your IO skills. I'm an IO psychologist. I have a terminal master's degree from NYU, and then I'm finishing up my doctorate through the CUNY Graduate Center housed at Baruch College. So very proud of that. Received some degrees en route as well, and I've worked hard enough that I've accepted all the degrees they've given me. But the most important is that I'm finishing up my doctorate at the end of this year. And I'll talk to you about that a little bit later. But there's lots of different ways for you to leverage IO skills in a health system as large as we are, with over 70,000 employees. And the first main area is that corporate shared services function, and that's really our centers of excellence where you can apply your IO skills in a deep dive way. And there's a couple of areas that we have that. If you can click the next slide, Irene. First, it is around team member experience. We have an employee experience team at Northwell Health that's actually led by an IO psychologist. I was a member of that team prior to switching over to Long Island Jewish Medical Center. And that team is really in charge of driving the strategy for our employee experience across the health system. One of the ways that they do that is by designing and measuring employee engagement and setting forth the tools that leaders will use to help drive engagement throughout the health system. It's very important to us as a health system to achieve being at the 90th percentile for engagement for both physicians and our team members, because we know that at that 90th percentile, that's where the magic happens. That's where we reap all of the positive benefits of having a highly engaged workforce. This employee experience team is really set up to drive that. They also create and design ad hoc surveys for the various initiatives going around in the organization as they have that skill set there. as well as analyzing the data related to those surveys. And they also own the recognition strategy and platform for the organization. So we are really big on recognizing our employees. We have a platform where points can be employees to cash in for on different items, but our system is really into recognizing people because we feel that's an opportunity to help boost engagement and also the right thing to do. Irene, if you can click to the next slide, I appreciate it. One of the things that I'm most proud of as a former member of the employee experience team is that we had an opportunity to create our employee value proposition. As an organization, we had a very clear mission and vision. See that throughout the presentation, that we are really lucky to work for an organization that has a very clear purpose, right? We are all here, whether we're clinicians or not, to deliver world-class healthcare. And we do that in HR by supporting the people who care for those people on the front lines. So we had a very clear mission and vision. We had a promise to those folks in the community about our brand. And we also had a promise to our patients through our culture of care about how we were going to deliver care. But what we were missing was that promise to our employees. What was our employee value proposition? And by leveraging our IO skills, creating focus groups, harnessing the voice of the employee, we were able to create an employee value proposition from the words of over 2,000 employees in our health system. And that value proposition then drove the refreshing of our employee values that you see on the right side of your screen. So we were really able to take the fundamentals, the research-based approach, and the structure that you learn in IO coursework and IO work and apply it to delivering a product that has changed the culture of the organization. Irene, next slide. I'm going to go very quickly through these because I want to make sure that we create an opportunity for you to have some time for questions. So we also have a traditional learning and development function, the Center for Learning and Innovation. And that's really an opportunity for IO grads and IO folks to design programs to train our leaders in the organization and also train our clinicians. We have a clinical arm where our clinicians go through different scenarios with mannequins and also live actor patients to simulate what it's like to have interactions. And those interactions and assessments are designed by IO folks, as well as designing orientations for all of our new employees and our new leaders. And then our high potential development programs and programs to grow leaders at various levels in their leadership journey. A-Lead and Lead Next are programs that IO psychologists have designed for frontline leaders and middle management or middle level leaders. And then we also have a change readiness team, also with some Baruch IO alum on that team as well. And I can't hear the applause because you're on mute, but I can see it. But that team is really at the forefront of leading, now I see it, leading some large scale changes in our organization, whether that's creating a culture playbook to make sure that our mergers and acquisitions of hospitals are done appropriately to allow those cultures to merge, or whether or not it's leading a large scale IT change in the organization. And we're going through switching to Oracle Human Capital Management Cloud right now. Full impact to our organization. That change readiness team is at the forefront of using Lewin's change model to really design the initiative and make sure the change is gone through in an appropriate way.
Okay, so another area within our corporate function is our talent management team. And really what they own from an IO perspective is our competency model and what behaviors are we looking for in our frontline team members as well as our leaders. And around that competency model, we have, as you can see here, our talent management timeline. So a lot of what you've learned about relates to our performance reviews and how do we recognize and reward our talent, goal setting, and then how do our team members and leaders develop plans to help them achieve their current goals, but also focus on their future career development. We have fully embedded within the organization a talent review assessment program that we engage in every year to see, where our gaps are, and strategically look at succession planning and how do we ensure that we have business continuity in our succession pools. So you can see here in our high potential program is embedded in there. So as we do our talent assessments and reviews, how do we ensure we have the right people in those programs who are on that trajectory?
Okay, so Mike and Irene, I think, did a great job of walking us through some of the ways that some of the HR roles that exist within our corporate functions in HR and what an IO can bring to those roles. What I want to spend a little bit of time on is what are the HR business partner roles look like when you are at a site like the three of us are. And Mike has transitioned from corporate function in our COE, a Center of Excellence, to a site role. And so it gives a really great perspective of the value you can add to both. And so when you're in a COE role, what you typically find is that you specialize in an area and you bring that whole specialty to the work that you do into your discipline each day. When you transition to an HR business partner role, it allows you to really take that specialty and then expand your scope as well. So you can add value based on your specialty. And we try to build teams on all of our teams where we have a good balance of very different types of skill sets and specialties. But once you're a site business partner, you also have the opportunity to expand your breadth. And that could be quite exciting. And many of us quite enjoy that work. As a business partner, you're very close to the business, obviously. So we have roles that are at all levels. You may come in as an HR representative and really be sort of the front line to supporting our team members, all the way up through HRBP and ultimately senior executive roles. And it really gives us an opportunity to understand the business, see it day to day, and help drive the strategy for the business. When we think about the role that HR can play, we are certainly culture leaders, right? We partner with our leaders to understand the environment using our workforce engagement data as well as other insights from our organization to try to direct and drive a positive work environment. As HR business partners, we're definitely collaborators, right? We see ourselves as needing to respond to all levels of the organization. And that can be something as simple as a complaint from a team member to our ability to influence the direction of the business. And then certainly talent is an area we spend a lot of time in, not only attracting the right talent, but growing and developing and retaining them. And if we think about the role that IO can play in this, right now we spend a lot of time trying to understand how the workforce is changing pre-COVID, and that was a priority of ours, and now it continues to be, and we have to evolve in a post-COVID world. Shows you how the external factors can really impact how we help support the business. So we look for gaps, for example. We look for gaps in our succession plan, gaps in our competencies that we think are needed in order to support the changing nature of healthcare go forward. We look for gaps in our staffing, right, where we may have opportunities to bring in talent that could be retiring at higher rates in the future. And so it becomes really interesting work because we get to see firsthand on the ground how our insight and guidance and counsel can impact the business directly.
So thanks, Donna. Really, as Donna transitioned from the COE world to a site-based business partner role, and it really is exactly what Donna said. It gives you the opportunity to hold on to your IO roots, but sort of apply them in a way that it impacts all the various functions that a business partner would participate in at the site. And I found it to be a very rewarding and challenging opportunity for me in my career, given that I spent the majority of it as a COE leader or employee. Irene, thanks. So there's just a couple of other additional opportunities that don't fall into one of the identified buckets, right? And I know as IO folks, we love models. So I would be remiss if we didn't show you some type of model. One of the projects that I'm passionate on, that I've worked on with Irene as well as Donna as part of our regional development is creating an HR competency model, updating our existing model and creating a new model that will propel us into the future. And the catalyst for this is that we wanted to create a system to grow talent internally at Northwell Health. And as an IO psychologist, we know we have to understand what we're developing towards. So harness those IO skills and built a competency model for what each of our business partners should have. That is their general competencies that you'll see in the light blue at the bottom of the screen, right? Those are things you might find on any competency model. And then HR specific expertise buckets that each of our business partners need to understand. The depth and the way that they action those competencies looks different depending on the level of the person at each of the sites. But nonetheless, our entry-level folks all the way up to our executives have to possess some aspect of these competencies to be successful. Next slide, please, Irene. And from that competency model, we built an HR university. That university has been temporarily paused due to the COVID pandemic, but we are going to push through to raise that very shortly. You use the 70-20-10 model of learning and development that we talk about all the time in IO psychology to create experiences that map to those competencies and a job rotational program to allow people to gain those experiences. We know that people learn the best from on-the-job experience, and so we wanted to capture that 70% in our design. We created small, focused learning circles and coaching sessions so that our folks could learn through others. And then we came up with a curriculum that is a hybrid of in-house produced courses and external vendor leveraged courses to capture that 10% of formal learning, so that our folks that go through the HR university at each level have a set curriculum that's then supplemented with experiences to allow them to apply those curriculum and then transfer the training back onto the job. Thanks, Irene. Next one. And then the last one is, for those of you that are interested in research, I have had the opportunity to scrap my initial dissertation topic and start it over again. Not something I would recommend, but being successful at your dissertation is about being passionate about the topic, and that's why I did it. And my focus is on understanding nurse engagement. We have over 10,000 nurses in our healthcare system. They are delivering care to all of our frontline patients in our 23 hospitals. And their engagement is something we monitor very closely and need to understand better. And I've partnered with Aon Hewitt to use their personality inventory called Adept 15 to understand how nurse personality interacts with a number of different factors on the job, resources and demands on the job, to then impact nurse engagement. And by understanding these, we can better train our nurses, allow our nurses to look out for flags that may lead to decreasing their engagement. And my hope is that this will be the initial validation study to show that we should be using personality as part of our hiring structure and part of our assessment battery. And so I'm really excited about this. My data collection was paused as a result of the pandemic, but I'm going to be picking that back up in another 4 to 5 weeks. And I hope to have some really interesting results. Because of the pandemic, I've also now added in a variable around resilience. I think that the resilience of our nurses interacting with their stable personality traits will have different impacts in moderating the relationship between personality and engagement. So more to come. Hopefully I'll be at a PSYOP near you someday with a poster session on this, but there are opportunities to take those passion projects in our health system and actually bring them to fruition. And this is in partnership with them. We have our own institutional review board at our health system, just like you do at Baruch College and CUNY, because we do a tremendous amount of research. So another opportunity for you to leverage your skills there as well. I know we're getting close to coming up on time. So we're gonna move into what we look for and then our opportunities. But before we did that, we're gonna try to show you a very quick video, and if it fails, we're gonna scrap it. But what I wanted to say is that if you haven't realized already, looking for jobs and interviewing in organizations as much about them interviewing you as it is you interviewing them. And while the job may look good on paper, you need to make a decision as to whether or not that organization is a right fit for you and what you're looking for. And the best way for us to show you what it's like to work at Northwell, boy, I hope this works because this is a big lead up, right? Is to show you our employee promise, our video of the words from our employees, right, about what it's like to work at Northwell Health. So take a minute to watch this if it works. Otherwise, just read the static words on the screen, and then we'll go into our opportunities for you and questions. So let's see.
Maria, can you stop my share?
Let's see. I can do that.
Oh, thank you.
Okay.
I think. Yep. Okay. All right. So far, so good, right? Okay,
Yes.
Let's try it. All right, let's try it.
From the smallest gesture to life-changing treatment and research,
We always act with intent, with heart, and with passion.
to make people's lives the best possible.
It's not a normal 9 to 5.
We're flexible
Hardworking,
And not afraid to push the boundaries.
To go the extra mile for our colleagues, our patients, and their families.
We are true to our beliefs and our quest to define the healthcare industry of tomorrow.
caring runs through everything we do.
It's who we are.
Northwell Health was not made for just anyone.
Here, we aren't satisfied with settling.
So we search for innovation in everything we do.
We are the explorers made for extraordinary discoveries.
The pioneers made for breaking with convention.
And the team players made for unwavering support.
It's not for the faint-hearted.
It doesn't just take courage and determination to do what we do.
It's that spark and instinct to care that changes lives.
We want you to spread your wings, grab unbelievable opportunities,
and fulfill that desire to make things better.
We are made for Northwell Health.
Made for caring and protecting our patients and communities.
Made for leading innovation and change that inspires our colleagues.
And turns tomorrow into a breathtaking opportunity.
We are Northwell Health.
And we're made for this.
Makes me smile every time. So we were very purposeful in choosing the wording "made for this," right? Because not everybody is made to work in healthcare. And of those folks that are made to work in healthcare, not everybody is made to work at Northwell Health. So it's very important to us that anybody that looks for an opportunity for us thinks whether or not they are made for Northwell, right? Because what we do is not your typical 9 to 5 job, right? We're all about the purpose of our work and putting in that extra effort to make sure we deliver that world-class care with compassion. So Irene, can you pull your stuff back up? Let's see. I'll stop my share.
Oh, look at that. We can see everyone. Hi, everyone. I think while Irene is pulling the deck back up, I think I'm going to pick up next and really talk about what we're looking for. And I think Mike really summarized it so well in terms of, are you made for this, right? And what does that mean to work at Northwell? I'll share personally, I'm a Baruch Zicklin School of Business MBA, and so not an IO, but nonetheless very, very proud of my education and value the time I spent at Baruch. And I spent the first 15 years of my career working in HR in financial services. And I made the decision to move over to healthcare almost 7 years ago because I didn't feel connected to the mission of the work. And although I very much, I had a wonderful career and learned so much during my time on Wall Street, I needed to do something with a different purpose that I felt connected to, and have never regretted that decision to come here, not even one day. It has been the most rewarding almost 7 years of my career. And I think, you've got to be bought into the mission, and that also means coming prepared, right? Taking the knowledge you have within IO, within HR, and finding ways to add value. Really having a passion for learning. That is something that we look for within our team. And I think, you know, the ongoing education amongst some of those on the call, right, are a great demonstration of that. You know, we are real team players here, and I know that's an easy thing to say, but I have the fortune of working with Mike and Irene and a phenomenal extended HR team, and we have each other's backs. Right? Nothing has been more evident of that than during this crisis, which I think can bring out the worst or the best in people, and it certainly has brought out the best in our one HR team. You have to be resilient. As Mike said, it's not a 9-to-5 job, and you can imagine that with the pandemic over the past couple of months, the type of resiliency that you have needed in order to continue and keep doing the right thing for our community, patients, and our team members, right? So it is not a 9-to-5 by any means, but if you believe in the mission and you make the investment here, I know, speaking from experience, it will be an extremely rewarding career. So, do we have roles open today? We certainly do. We have a large HR organization, close to 500, that support the 70,000+ employees at Northwell. We thought we'd be a little bit selfish and share with you the 3 roles that we have open in our HR business partner function within our region, right, in our hospitals that represented today, as well as our sister hospitals that are within our East and Central region. So basically everything from Queens to Long Island to out to Suffolk County. And so we have an HR business partner role, actually 2, both here at North Shore as well as at Southside Hospital, which is Irene's hospital. And these are sort of mid-level HR roles. We typically look for 5 to 7 years experience, progressive experience within HR. And we also have a specialist role in HR at Plainview Hospital, which is one of our community hospitals that is in Nassau County. Excellent hospital as well. And senior specialist role is the role right before a business partner. So you're just starting to get your own client group in that role, and it is a great development opportunity for someone who wants to go down the business partner path. We shared with you the link to our career site, which you see up top there, jobs.northwell.edu, because there are many other roles, including many in our COE function, our centers of excellence, as well as our other regions, which include West, Manhattan, Westchester, and Staten Island. And so we would encourage you certainly to go to the link and check out those jobs. We are going to share with you our contact information as well. And as 3 Baruch alum on the call, we certainly know that very talented team members join from Baruch, and so as well as the CUNY organization. So we're excited to have you come and check out some of our roles. Okay. The last thing we're not going to play, but we wanted to share it because it's something we're very proud of, is a link to our COVID-19 response. We have a lot of pride around the way that Northwell Health has been a leader across the country around response to COVID-19. Our CEO, Michael Dowling, was already renowned as a healthcare leader, and we even more so today, feel that sense of pride. We have worked at not only taking care of the community, but putting our team members as the top priority, and that's work that all 3 of us support on a daily basis. And so, we thought if you have a few minutes after today, if you want to click on that link, it's just a really great compilation of all the media coverage around Northwell Health and the way we responded to the crisis. I think thank you for your time, and I think we're going to open it up for some questions, right?
Oh, am I unmuted? Okay, good. What is the best way for and I say entry level, meaning somebody who is finishing up their master's or even who's still involved in completing their master's, what opportunities are there for that grouping, and what do you look for in terms of skills, et cetera, if their experience is, limited? Anybody?
Okay, I think we're looking at each other going, who's going to take that one?
You go first, Donna.
I'll give it a shot. So Mike and Irene jump in. So, so I think, when you're first, entering an HR role, I think, there's a lot of value to sort of starting at the beginning, because there are core skills that you develop at an HR representative or specialist level role. With a master's, a specialist role, it would probably be more in line with your skill set. And our specialist roles, they're kind of the first taste you get to what does it mean to have a client base. It allows you to bring your specialty knowledge to various work. You get to touch soup to nuts. What does it mean to be a business partner within a site, within a client group, while still having the support of someone with more experience to guide you. And so I think the specialist role is really a great place to start, because it's worth, even if you can progress quickly through it, it is worth sort of getting the core skills under your belt. And it will still give you an opportunity to add much value, whether it be around talent management, engagement, data metrics, and analytics.
And can you say a little bit more what you look for in terms of, like, you're looking at a resume for the specialist role? What would stand out to you?
Sure. Mike, you look like you want to take that one. Go ahead.
Sure. I would just say we're looking for somebody who's had some experience, right? It doesn't have to be years and years of experience, but right, if you've interned somewhere, right, if you've had some exposure to HR in some form, right? And then also I think we're looking for somebody who asks good questions, because you're now going to be thrust into a world where you may have an academic basis of knowledge, right? You've learned through your IO studies all of these different facets of IO, but you really need to understand how to ask the questions to apply that knowledge to the job. And it doesn't look the same everywhere, right? And so it's about, have you worked before, right? Have you been in the working world? Have you worked in organizations? Have you had exposure to HR? And then, are you passionate, to Donna's point, about learning and asking the right questions?
With this, do you look at cover letters then? Would this be in a cover letter, someone trying to bring together their passion for HR with their whatever limited experience with that?
Yes.
Yes, and I would even add to a connection to our mission. And when you watch the employee promise and you see what that looks like and what a workday looks like, ensuring that you're connected to that mission and wanting to, as Mike said earlier, care for people who are caring for people. And the COVID situation was a key example of that. Although we are not frontline team members, we were pivotal being on site and showing that we were there to support them. So being connected to that mission is also important.
Yeah. I think that's a great point, Irene, and I would add to that, it is very rare that I not ask in an interview, why Northwell, why healthcare, right? So I think you'd want to be thoughtful about how you answer that in an interview, just to drive home Irene's point. And I would say, in addition, I typically look for someone who has demonstrated that they understand what the value of HR is. I know that sounds obvious, but what does it really mean to be a strategic HR business partner, right? And what can you bring to that?
All right. Just another quick question. Is there, do you hire international students or people who need visa support or have visas?
We do. I guess I'll take one. So we do. Obviously, there are some limitations based on visas or being approved, right? And we've seen obviously some challenges with that of late. But we certainly are open to it, and I'd appreciate that. It is a process that can take some time, and so we're sort of living by the process right now, but we are certainly open to it.
All right, going back up, it says, Michael, are there opportunities at Northwell to assist with research topics such as yours?
Certainly I mean, if you're interested in potentially working with me or working on the data, you can reach out to me afterwards to discuss. But yes, there are opportunities for IOs to assist with research. even if it's not directly with me, the employee experience team does that a lot. As I mentioned earlier, it is led by an IO psychologist, Dr. David Gill, and I'm happy to forward you on to him as well to see if there are any opportunities to assist on some of the projects they're working on.
Great. And do you have independent contractor opportunities available?
I'd be curious what what that means. Consultants to come into the organization. If that's the case, then yes, we do use consultants in various ways. Absolutely.
And what is the best way to transition from a specific facet of HR to a generalist function or an HR BP role? All
right, I guess I'll take that one because it's my life story. No pressure. No pressure, Mike. Don't mess this one up. So I would say the way that really helped me transition was as a COE owner, right? A person in a COE, I spent a lot of time, or tried to spend as much time as I could, interacting with folks from the site, and in some cases had regular one-on-ones with those folks at the site. That helped them see that I was trying to be a good partner, and it was also helping me understand what their needs were from me as the COE driving certain processes. There were times where it wasn't as successful, to be honest, as I wish it could have been, and I didn't understand that till I moved into my new role. But I think the best way to do it is to start to network with the folks that are on the other side, show your interest, and try to get involved in things on the generalist side, right? I think that's the first step. And then put your hat in the ring if an opportunity is there, and explain to them how you can leverage your knowledge to apply it to the generalist side.
And I would add, so prior to Northwell, I worked for JetBlue in the corporate talent management function. And my entire 8 years there was in corporate, and I joined Northwell in an HR business partner role. So I made a change from an organization to another organization to a business partner. And what I would say is I believe that having a COE experience is an advantage because, as Donna mentioned, each person brings their own specialty to the generalist function in the field. So I feel like, that helps prepare you to understand, one, the corporate side and how you're developing things and implementing them into the field. But actually, when you get to the site, and Mike can attest to it, it's very interesting to be the receiver of a product, and it actually gives you a whole new perspective. But I digress. But the idea is that it can happen within an organization or from another organization into Northwell.
Yeah, I agree. And I would highlight something Mike said around sort of throwing your hat in the opportunity. I think that is sort of just good advice from a career standpoint anyway. And this, we in our organization, we have many opportunities for our team members across functions to come together and work on various projects. There's sort of like no end to the opportunity that you can throw yourself into, whether it be in a formal role or not. And not everybody takes advantage of that. And so when you do, it allows you to relationship build, like Mike said, to get exposure and experience doing things outside of what your specialty is. And so I think that's just great career advice in general that I've followed in my career, and I know Irene and Mike have as well.
And lastly, I would say I've had people in the COEs come to the site and spend a day or shadow and so that they can better understand the business and what the role is like. So they get a little bit of a job preview before considering moving from a COE. So I think that Northwell is an organization that's open to career development and movement. So we, including Mike and Donna, we provide those opportunities whenever we can to get people those experiences.
Sounds good. So in terms of if someone has no HR experience at all, do you look at transferable skills? Is that something that would get your foot in the door for, let's say, the specialist position?
Absolutely. And I think that would probably be more apt for a representative position, a rep. where the individual will be working directly, answering inquiries from employees walking into the HR office, right? Educating them on different things related to benefits and leaves of absences and payroll questions. And that's really a good way to build that generalist foundation like you would in any other organization. And that's how you get your experience.
And on my team, I have an HR analyst. And, that's someone locally who's helping us use data to make better people-related decisions, but it does tie to IO because they're analyzing engagement data and turnover data. You get the idea. And the person that I hired was previously a financial analyst. So didn't have an HR background, but had the skill set to be able to analyze data. And with our guidance and expertise, being able to teach them the HR component.
Well, related to analytics, there's a question on how much emphasis is placed on data analytics and which systems are used to analyze data.
Okay, I think we all get excited about this question. So
you're supposed to, you love data. Go, Donna.
Yeah.
Watching to see who was going to come off mute first. I like to think of data as really not just about the data, but about the story that it tells. And I'm sure you've heard that before. And from an HR perspective, right, data it can be so rich and helpful because it takes the emotion out of things, right? So our Chief People Officer, Joe Muscola, once gave me that piece of advice, right? That how do you move your leadership past the emotion of the decision, and that data is the thing that can help you do that, right? Because you can't argue it. There's no emotion in data. And so I think, the data is a starting point, but then what are the analytics that you put around it, right? That help drive the business becomes more important, right? I think it's easy to learn how to manipulate an Excel document, but if you can build analytics that tell the story, then you're going to be much more influential with your clients. We use a number of data sources. I'll share that we are currently in a system-wide change effort to upgrade from PeopleSoft to Oracle Cloud. And with the cloud is going to come much more analytical capability that we can put at the fingertips, not only of our HR teams, but of our leaders as well, right? So that managers will have dashboards and better analytics that are shared with them and are accessible to them on a regular basis around their departments. So we're quite looking forward to that. We were supposed to go live mid-year, but we've delayed because of the pandemic and are now on track for a January 1 go live. And so we're quite excited about sort of the upgrade of our technology so that we can do the things more efficiently than we are today around data and analytics. And Mike, Irene, anything you would add?
Perfect.
What would you say some of the challenges of HR in a hospital system are? I guess we should say before a pandemic hits.
I think our challenges are not different than the challenges that any HR practitioner is organization, right? And that is that we have to do our best to support an organization that has a separate primary purpose than HR, right? So our doctors, our nurses, our operators are all there to make sure that care is delivered appropriately. And in HR, we have to do a good job of convincing them that our initiatives, our function, our strategy aligns with their strategy and is in support of that, right? And I think we have to be very conscious not to disrupt their operation while we're deploying our HR processes, right? So we're all big believers that performance management and feedback and doing all those things are very important to the growth of our employees, right? To the health of our organization. It's important, but we have to deploy a process that doesn't disrupt the practitioner's ability to deliver care, that it's not too cumbersome and takes up too much time. So I would say that's definitely not a unique challenge, but a challenge that we face in our organization as well.
Yeah, and the only spin I would add that for me was evident when I moved from other industry to healthcare is that You know, in other industries, you say things like, we can try this because what's going to happen? You're not going to kill somebody, right? And it sounds terrible, but in healthcare, right, there is a person, a patient attached to the end of every decision. And every decision we make is rooted in that, as Mike said. And I think that adds a unique challenge, opportunity as well, but a unique challenge when working in HR and healthcare.
Do you offer internships and, you know, for somebody in the middle of their grad, you know, career? And if so, what do you look for and where would you post those?
So yes, we do internships. This year we have paused them just because of everything that's happening in the work environment. And historically, I have had interns, both undergrad and graduate, and typically we give them a specific project to work on for the duration of the internship that's going to have not only an impact on the operation and the employee experience, but also benefiting their learning. So just a brief example, this was an undergraduate intern. We had her do a needs assessment around our day 2 site orientation. So after they go to the big one, they come to us locally and redesign that program based on their findings. And we implemented every recommendation that that individual made.
And would you say you look for similar things in terms of a passion for HR, or if they don't have any experience, obviously this is how to get experiences. Would you say, can you add to that maybe?
Sure. So I would say on a degree trajectory toward an HR degree or IO degree, and they don't necessarily need any experience because the experience is the internship. And historically, we do pay our interns.
And do you see resuming these internships anytime soon?
I'll defer to my colleagues on that one, but I don't know the answer.
I think, unfortunately for the summer, this internship program generally runs in the summer and is a rotational from a COE where you spend half the time in a COE and half the time in a HRBP function. Unfortunately this summer we've paused, right, because of so many unknowns. But if things, you know, are more stable, we hope to resume all of our internships next summer.
And this
so we would start that application process next spring.
Next spring. All right. And then people could just go on the website and look for internships. Is that okay?
We do post them on the careers website that we shared earlier.
And this question is from Mike about what made you decide to do a PhD, and is it necessary for upward mobility at Northwell?
That's a tough one. I tend to have a bit of a mastery learning orientation. So I like to understand the weeds of things. It's something I work on now, right, in my HR operator role, because it's not always available. But after I got my terminal master's at NYU and worked, I realized that if I wanted to have more opportunities, going back to school was a way for me to do that. At that time in my life, being much younger then, I wasn't sure whether I wanted to go into consulting, whether I wanted to be in an organization, and the PhD afforded me the opportunity to move freely throughout the world and decide what I wanted to do when I wanted to do it. It is absolutely not necessary to grow in our organization. And in many organizations, it's not necessary. For me, it was more of me doing it for me than doing it for, you know, the opportunities. PhD programs are difficult and require a lot of time, and you really have to be in it around your passion to get you through it oftentimes.
Well, I think we're going to wrap it up on this, on that note. I don't know did you want to add any final words, Michael, Irene, or Donna? Not necessary, just asking.
I just want to say thank you again for the opportunity. I've spent a lot of years at Baruch. The college and the CUNY system has done right by me for a long time. Many years ago when I had much more hair, I started back there. So I'm appreciative of the opportunity to speak to all of you and feel free to reach out if you have any other thoughts or questions afterwards.
Well, thank you all so much. The work you're doing at Northwell, and especially during this moment in particular, but ongoing, is great. The thoughtfulness of employee engagement and taking care of people who take care of other people, I really like that. If I was doing another career, I would pursue it.
And know that Baruch prepares you. You know, I'm a Baruch alumni, Donna's a Baruch alumni, Mike as well, and look at our trajectory. So the education that you're getting there and the value of it is just the foundation, and you can take your career wherever you want it to go.
Absolutely. So thanks again, and thanks for everybody on this who joined us today. There's one more information session next week with PepsiCo, so feel free to join that one. But again, thanks so much for the work that you all are doing at Northwell, and it's a 3-day weekend, so enjoy everybody, and we'll see you all soon. Thank you.
Great. Be well.
Take care.
Be well.